30 minutes with the pharmacist, and it's great to be here. And today, what are we talking today?
We are talking about managing common side effects and when to worry and when to seek for help.
When to worry and when to seek for help. So, from the question, that was the first thing I'll ask. When do we worry? When do we seek for help? When should I start worrying? Like, I'm asking, how can we...
Okay, firstly, because people don't actually understand the full meaning or the full scope, what a side effect actually is. Some people actually think it's just a coincidence that you can use a drug and you just get irritations and, start seeing bumps and everything. So what exactly really is a side effect? Yeah.
Okay, to talk about side effects, let's talk about main effects.
Okay.
So the main effect is you take a drug, you expect to get better. So the drug is supposed to give a pharmacological response.
Okay.
Let's say you have a headache and you take paracetamol.
Yeah.
You're expecting to feel better, right?
Yeah.
Then a side effect is an unintended response or an outcome that comes from the use of that drug, a treatment or a procedure. From the drug, I've given you an example of paracetamol. For a procedure, let's say anesthesia was administered. You see the site of the anesthetic procedure starts swelling. So that's a side effect.
What's an anesthetic procedure?
Let's say a person is about to undergo a cesarean section.
Okay.
And anesthesia is administered, right?
Yeah.
So you see people complain, they have severe pain at that point. Some will tell you there's a swell. So those are side effects.
Okay.
Then for a treatment, let's say chemotherapy.
Yeah.
Some people after taking chemo, you see situations where their hair fall out, and some are extremely weak. Some you see yellowing of the eyes. These are side effects. So side effects, it could also be positive. You see people who take certain medications because of the side effect of the drug.
Wait, let me get that. They take certain medications because of the side effects.
Oh, yeah. You see certain medications that are appetite stimulants, but the side effect is drowsiness. So you see, take for instance, cough syrups that are for cough, but the side effect is drowsiness.
I knew she was going there.
Okay.
Cough syrup, yeah.
You see cases where there are medications that are for pain, but the side effect is mental stimulation.
Oh.
There's a popular one that people are using right now for weight loss. I don't want to mention the name.
Please don't.
However, it's for diabetic patients.
Oh, really?
Oh, yeah. It's for diabetes mellitus, actually type 2. But people are using it for the side effect. So when they use it for diabetes, the side effect is you see the patient starting to lose weight. It's for also your cardiovascular management. So apart from the fact that the person is taking for diabetes, the person is also managing effects that could arise from cardiovascular issues. So but the side effect is weight loss. So people are now using the medication for weight loss, for the side effect.
Okay. Do you want to chip in?
Well, she has said it all. Side effects, like the name implies, is effects by the side. It is not the intended effect, but it occurs anyway.
Yeah.
And sometimes it could be positive.
I was going to go there.
Yes.
It could be negative sometimes.
Oftentimes it's negative because it's not the intended. It's not the reason you took the medication.
You said oftentimes it's negative.
Yes, because this is not the reason you took the medication in the first place. That is why we see it as negative. But like my colleague said, sometimes we take advantage of that side effect and use the drug for another purpose that is not meant for.
Okay.
Yes.
Okay. So that is it so what do we do about that, people taking drugs for the side effects? Is there a way to control that?
Well, what we can do is to educate them.
All right.
It is not right, but we can educate. But sometimes even we in the medical field are forced to do that, depending on how the problem presents.
Okay.
But with counseling and education, we advise the patient on the best way to take it and what to expect when taking any medication. Yes.
Okay, are there certain, this is just like me just being curious, okay? Are there certain people, that suffer from certain side effects? Because there are certain medications you get, and the doctor asks you if, they ask you your age, they ask you your weight and everything. Is that to preempt a side effect or something like that?
Okay, there's what we call pharmacokinetics.
What?
It is, pharmacokinetics. It is what your body does to the drug. when you take it. So we have 4 factors to consider: the absorption of the drug, the distribution, the metabolism, and excretion. So depending on your weight and certain factors, different people, different body physiology, your body will react to it separately. I give you an instance. Someone might take a medication and experience drowsiness. Another person might take it and not experience it at all.
Okay.
You understand? So for the side effect, sometimes when you tell your prescriber or your pharmacist about the side effects you are experiencing, like she mentioned earlier about people who use this medication because of the side effect, there's a control that we can actually enforce. There are certain medications. I give you an example: antibiotics. I'm not supposed to dispense antibiotics to you without a prescription. So that way we can curb the way people actually have access to these drugs and reduce side effects, which could also be detrimental to the health of the patient.
So with that being said,
if I may add to that, I said doctors often ask you if you have certain reactions to some drugs. Yes, because the truth is that all drugs have side effects, and like my colleague said, one person may experience it, another person will not. Like for example, the popular chloroquine, for some people it itches them, for others it doesn't itch them. So the doctor will ask so that he can prepare your mind. Even when you come to the pharmacy, before we dispense the drug, we'll ask you, do you react to it? For example, if the doctor writes MGO tablets, we'll know the popular side effects, maybe nausea, vomiting, like somebody feels like vomiting or actually vomits after taking it, and we know how the person can curb it. So we can now advise the person, as you're taking this, make sure you eat well, make sure you don't take alcohol, because these are issues that will cause problem for the patient, so that he will not tolerate the drug. So we ask that question so that we can advise the person on what to do while taking the drug, because he needs that drug. But if after asking we find out that side effect is too much for that patient, we can advise on an alternative, but we must ask. Yes.
And it's so bad because some people now take certain medications for the side effects. Like some drugs, I'm not going to mention them, but they kind of, it's not intoxicating. They get people high, and we find them taking those drugs. Isn't it harmful to them in some way?
Of course it's harmful to them.
All right.
It is, because when you are taking a drug for a wrong reason, it's not right. It is wrong. It's drug abuse. It's drug abuse. It is wrong. So what would you keep on educating them? For some people, if they come to the pharmacy, of course we won't sell, because we know you don't need it. We are not just there. Yes, if you come to the pharmacy, you're buying a drug for the wrong, like my colleague said, people take cough syrups to feel high. We know you are not coughing, you don't need it, so I won't sell.
True.
It's my job not to sell to you because you don't need it. You are buying it for the wrong reason. I will educate you, but for that which you need, we will advise on what to take. And even if that one you need has side effects, we will advise you on what to do to curb those side effects or to manage the side effects.
And that's another thing. There should be control on how these drugs are sold, because we find some people that just go out there and just come purchase anything. There should be a lot of control. You're still on 30 Minutes with the Pharmacist, and we're going to go on a quick break now. And when we return, we have some questions. So if you have some questions, have you got the numbers to call?
Yeah, I got the numbers. 070 410 31.
Okay, we'll say it doesn't seem to be